Hi, welcome to Pathology Riddles. Today we are going to deal with this topic called as hyperplasia. Last time we spoke about what is hypertrophy and we also learned about what is cell adaptation. Today we will see what is hyperplasia. So what is the definition of hyperplasia? Hyperplasia means there is increase in the number of cells in an organ resulting in an increased size of the organ or increased mass of the organ. So in hypertrophy, we saw that there is increase in the size. And here we have written hyperplasia 3 times because to show you that this is increase in the number of cells. So in whom does this hyperplasia occur? It happens mainly in the labile cells and stable cells. As we have learned, there are 3 categories of cells. Labile cells are the ones which keep proliferating on a daily basis. Stable cells will proliferate whenever there is a requirement, if there is an injury or if there is a need. And permanent cells are the ones which do not proliferate after birth. So we have got hyperplasia in organs like labile cells and stable cells. So what is the mechanism of hyperplasia? The mechanism is either there is proliferation of differentiated cells. By differentiated cells, we mean the mature cells, or the stem cells or the progenitor cells are going to release more and more cells which will later differentiate. So if the cell is healthy, for example, if there is liver resection, there is a diseased part of the liver, and the remaining part of the liver will have cells which are healthy. Those cells can proliferate and give rise to the part of the liver which has been removed. Means the liver can regrow. But sometimes the remaining cells also might have some kind of injury. They will not be able to proliferate. At that time, the stem cells of the liver are going to give rise to new liver cells. They will give rise to new cells which will mature into hepatocytes. So they can either multiply from the differentiated cells or from the progenitor cells, and that's why we have increase in the number of cells. So what is the mechanism of hyperplasia? As we already saw, it is stimulated by growth factors or hormonal stimulation. Okay, growth factors or hormonal stimulation will cause the multiplication of differentiated cells or progenitor cells. So what are the types of hyperplasia? There is physiologic hyperplasia and there is pathologic hyperplasia. Physiologic can be divided into hormonal hyperplasia and compensatory hyperplasia. So let's see which are these examples of these types. So hormonal hyperplasia. In physiologic hyperplasia, we have got hormonal hyperplasia. Example of hormonal hyperplasia is in puberty and lactation. Okay, in puberty and lactation, suddenly there is increase in the size of the breast, right? That happens because of hormones, mainly estrogen. While compensatory hyperplasia happens if a part of the organ is removed. For example, the most important example here is the liver. So the residual tissue will grow after the removal or loss of part of an organ. So a beautiful example for this is in Greek mythology. There was this Prometheus. Since Prometheus had stolen fire from the gods punished him by tying him to a rock, and every day the eagle used to go and eat a part of his liver. But the following day, the liver would regrow. So as old as Greek mythology, they knew that liver has the capacity to regenerate. So then we come to pathologic hyperplasia. In pathologic hyperplasia, an example is endometrial hyperplasia. Now, usually we know in menstruation what happens is in 10 to 14 days soon after menstruation, because of the estrogen, it is going to regrow. The endometrium will regrow. Then there will be secretory changes in the endometrium after 14 days. But sometimes that is due to progesterone. But sometimes what will happen due to imbalance of the hormones, there will be increased estrogen, and because estrogen is a hormone, it can cause pathologic hyperplasia. Okay, pathologic hyperplasia is a fertile soil for the growth of cancer. But there is a difference between pathologic hyperplasia and cancer. In hyperplasia, it happens mainly because of these hormones, excess hormones. But if the hormones are inhibited, or if the levels of hormones are controlled, then this becomes a reversible change. You need to know that there are no mutations that are happening, or there are no genetic abnormalities that are causing this hyperplasia. But in cancer, there is genetic abnormalities that is causing increased growth of the cells. There also there is uncontrolled growth, while in hyperplasia it is very limited growth, and if the hormones are removed, then it can come back to normal. Another important point to know is pathologic hyperplasia is a fertile soil for cancer to grow. So these can be the precursor lesions. If it is not treated or not controlled, it can lead to cancer in future. So we need to know the importance of this pathologic hyperplasia. Another example of pathologic hyperplasia is BPH, or benign prostatic hyperplasia. Now this happens in males. So there is increase in the number of cells in the prostate, and it is because of increased androgens. So today we have learned about what is hyperplasia, the definition, what is the mechanism of hyperplasia, what are the examples, what is the physiological types and examples, and what is pathological types and examples. Then we also learned about why is it important to know about pathologic hyperplasia, and that is because it can go into cancer if it is not controlled. So that's about this topic. In the next class, we will learn about atrophy. Okay, I hope these concepts of hypertrophy and hyperplasia are clear. If you have any doubts, please write in the comments below. This is Dr. Susan signing out till we meet in the next video.